Cosmetic dentistry has really flourished in the past several years. There's just so many more options we have available. When I became a dentist 20 plus years ago, we didn't have as many options, but now there's tons of options, ways that we can help patients improve their smile. Before we go over the options, let me just tell you briefly that our basic principle when doing cosmetic dental work is to do it in the most conservative way possible. So we want to preserve as much teeth enamel as possible and any other oral structures so that it's very minimal manipulation or changing of any kind of tooth structure, so we can still get the final result that the patient wants, but do it in the most minimalistic way. Let me kind of go over real quickly some of the ways that we do this. Invisalign. Invisalign is actually a way most of our adult patients are going through and moving the teeth into the right spot. Imagine they have some spaces. They can close the spaces with these little clear trays, or they got some crowded teeth. They can unravel those crowded teeth. They can even improve the bite. And so what Invisalign is these clear aligners. They're basically little thin trays. You slip them in, and patients wear them day and night. And over time, it starts to move the teeth into the right spot. And most of the cases that we do here finish somewhere between 9 and 12 months. That's about how long Invisalign takes. Another option, say someone has a space or they've got a broken edge on a tooth, we can go in with a thing called bonding, which is a tooth-colored resin that's actually, it's stuck to the teeth. It's a way of just kind of fixing some little small problems with bonding. It really is a very nice way to just tweak the smile a little bit. We also can do teeth whitening. Over the years, we all kind of take on stain with our teeth, and so teeth whitening is a way of kind of bringing that shade back up to a brighter color. We also have gum reshaping. With a laser, we can go in, and it's a very minimally invasive procedure, and we can actually sculpt the gum so it has a more symmetric look. How the gums lay on the teeth is a very big part of how a smile ultimately looks. And of course, we also offer veneers. Veneers are porcelain coverings that go over the front of the teeth. And sometimes it requires several teeth, and sometimes it's just a couple of teeth here and there. They just need a porcelain covering to just make the overall appearance of the tooth look better. Before we get started with any of our cases, what we do is a smile simulation. We could use an intraoral camera, which it's a 3D camera, and it kind of makes a virtual model of how the teeth are now. And then we can play it through the Invisalign simulator, and we can show what the teeth will look like when they're in the right spot. Another thing that we can do is take a photograph of somebody. We take a photo and then basically do a Photoshop new smile on top of it. And we can actually not just lay a complete smile, but we actually work with each individual tooth, so we kind of make it as realistic as possible. What we find with these simulation devices, whether it be with the 3D model or with the photograph, it offers a chance for us and the patient to have a really good communication of what they're wanting and what we're able to deliver, and make sure it's a very good match before we ever get started. So doing a smile simulation is a really key first step in our office in doing cosmetic dentistry. Anyway, doing cosmetic dentistry is something that I know I love. I know the other doctors here, they love doing it as well. It's just, it's great to see the impact it makes on our patients' lives. And so if that's something that you're interested in and want to talk more about that, we would love to visit with you. So please give us a call, and we will hopefully see you soon. All right, take care.